All right. Hello, everybody. We're going to go ahead and get started. Thanks for joining the latest session of the PPW with SUD ECHO session. We have our didactic presenter is Amanda Newhouse today. We do not have a formal case on the docket, but that doesn't mean we can't have questions and answer after about the didactic or any other issues or anything you would like to discuss. Again, for those who just hopped on, please put your information in the chat for intros and attendance. And with that, Amanda, you should have the ability to share your screen and go for it.
Okay. Hi, everyone. I'm Amanda Newhouse. I'm clinical social work faculty at WVU Medicine. I am going to share my screen. I better put share sound because I do have a video clip. And are you all seeing my slides? Yes, perfect. Okay. So today I'm going to be talking about the impact of substance use disorder in early childhood. And for those of you who've heard this before, I have still a couple little tidbits I changed up in it. But as we talk about this, as many of you have heard me talk before, it starts with attachment. So I always start at the very beginning with attachment. And we all know how important those first few hours and first few years are in a dyad between a pregnant person and an infant. And so, an attachment is this connection that happens over space and time. And it actually even starts prenatally. And so we see that once a pregnant person turn some of those outward emotions inward, that attachment starts to begin. Those rates and rhythms start to become in sync, and they start to build a relationship even that early on. And we know that the earlier that relationship starts building, the acceptance of that pregnancy and moving forward, it's been linked to positive postnatal development in relationship to the dyads, smoother deliveries. And we also know that, negative experiences prenatally are associated with negative postnatal development. And so anxiety and depression, not only in the pregnant person, but also within the child. And so we see some of that distress within the infant as well. So it is really important. And we know that secure attachment matters. We know that it builds that empathy, that ability to socialize, to feel comfortable in their environment, in their world, to explore, right, to cooperate. And so it leads to later school skills, school readiness skills, self-reliance, wanting to take that initiative towards tasks, cooperating with others, getting along with peers. So it's linked to so many other relationships throughout an individual's life, and then later on their lifelong relationships. So we see how early on, how very important it is, and even throughout their life. And we know this because within the first 3 years, a child's brain is significantly developing. And so we think of what those needs are early on. And of course, they're basic needs, right? So there's the shelter, clothing, food, right? Those are all so very important for their brain development, but also those social emotional needs that really help with brain development. So communication, relationships, being able to effectively communicate those needs, right? So crying or making noises or getting attention to get fed, to get changed, to get those basic needs met, right? Infants and children need to know that they're effectively communicating, and how they know that is we respond to them. And so that response is huge, right? That's that serve and return. They need that serve and return. Adults need that serve and return from children, right? We want to know that we're meeting that child's need, and that actually provides this reward in our brain, and it kind of feeds into that those reward circuits, and helps build that part of our brains as well. And then this builds into relationships. So meeting those needs early on for infants is all about how they build their relationships, right? That's how they start trusting people and staying involved. And so that's really important. And then also stimulation. So finding that interaction, again, that serve and return, right? Serve and return is not only crying and getting fed or whining and getting their diaper changed, but it's also smiling and getting another smile. And so that serve and return comes in many forms and many ways, but this is also very important for relationships and for brain development. Now, when we talk about adding a substance use disorder, we're still talking about the brain development. Now we're talking about it in the sense of the caregiver, right? So, if the caregiver is the one struggling with a substance use disorder, or anyone in the family, right, completely restructures and rewires that brain and that circuitry. And so it's really important to understand how infants develop and then how substance use impacts adults as well, so that we understand how that dyad flows and how sometimes it can get derailed as well. And so that's where we kind of want to be able to intercept in that area. But with substance use disorder, we know that reward circuit is completely overstimulated, right? And remember earlier when I said how important it is to meet that communication and meet those needs of infants? Well, when we do, it kind of feeds that reward circuitry in our brain. And so it's really helpful for individuals who are struggling with substance use disorder to meet their child's need. But sometimes that can be really difficult. And we'll talk about ways to kind of manage that. We also know that they're already dealing with some of their own flood of emotions, and dealing with their emotional availability. So that makes it even 2 times harder to be emotionally available for another person, another individual. So they're working at it 2 times as much. And so there's a lot that goes on with that entire family system, has a huge impact. When we think of a family system and when we think of recovery, it really is a parallel process, right? It's never one individual going through recovery. Really, it's everybody within that whole family system. So if you think about, in the stages, there's a denial stage. And when an individual's in denial, you hear them saying, well, it's not really a problem. And, I can do it at leisure. But then you also hear family members saying that and saying, well, I don't really think they have a problem, or I really don't see where they could use, right? So almost, family members are in denial as well. And then that change piece comes, which can have a huge impact on the entire family system. So when an individual in recovery moves towards change and they make that decision that they're making this change, they're moving towards it, they're motivated, they're going to manage this change, and change does happen, right? So they change everything, literally everything, people, places, and things, everything they're used to being around, all the people they're used to being around. And when they have a family, this means the family system changes too. And so even though it's for the good, for early on in early childhood, that's very scary, right? So kids 5 and under memorize patterns of interactions, and that's how they really survive. It's not about their cognitive capacity to understand, but it's about memorizing. And even if those patterns of interaction were unhealthy, that's their world, and that's what they know. And sometimes when that changes, it's really hard for them, and they give lots of behaviors, right? So they can externalize some of those internal feelings, and they can give lots of behaviors. And so sometimes we come across parents that are really struggling during this stage of change because their children are acting out significantly. And so when, if you I think about some of the families I work with and how some of the caregivers just feel like they're failing already, and then this stage of change comes, they're making successes in their recovery world and staying sober, and they're working hard with their emotions, and then here comes all these behaviors from their kid, and they're like, I can't even take care of my kid, like I'm failing all the way around, right? But it's not that, it's that these patterns of interactions have changed, and so we have to find ways to mend and repair that. And so it can be a really trying area. It can be hard to admit too, because if you think about everything some of our patients go through, you know, a lot of the times CPS is involved. And so a lot of the times they're fearful to talk about this and how difficult this can be, but it places a huge strain on their sobriety as well. So it's really important to look at the whole family system. And then of course, reoccurrence, if a reoccurrence happens, then that kind of impacts the trust within that family system and the trust that they've built. And so they have to start all over again, which includes so many emotions. So there's really a lot that's put into the whole family system, and it really is a parallel process amongst everyone. But the nice piece with pregnant people in recovery is that they're really highly motivated, and a lot of the times they're younger, and their recovery is, or they've not been using as long. So they've not been, the disease isn't as progressed as if they were using for a while. And so a lot of the times this can be helpful. Sometimes they still have healthy family supports, sometimes they don't. Many of the times they're more hopeful towards the future, more willing to be abstinent, and so this can be really helpful as they start to look at the whole family system. But sometimes it can be very overwhelming, right? Because we know that pregnant people and women who struggle with a substance use disorder, they're 80% of them have complex trauma. And so complex trauma can come at many different layers and levels with individuals in our area. And so we look at like abuse, maltreatment, right? Loss, violence, so much violence. And this completely restructures and rewires the brain, and trauma is linked to emotional attunement. And so parenting is all about being emotionally attuned, right? And being emotionally available. And when you have so much trauma, it can be triggered very easily. So that can become a huge barrier. And there are other risk factors when we're looking at families who are in recovery. Impaired attachment themselves, right? Talk about complex trauma. Many of the times they have their own impaired attachments to their attachment figures. If you think about some of the families we work with, many have so many economic hardships. You know, I have so many families that are struggling to rebuild their credit and doing a great job at it, but we all know that's a hard task to overcome. So rebuilding their credit, overcoming fines, right? Many have legal problems, paying for urine screens, or paying for separations, or, you know, paying to live, to figure out supportive housing, to pay for their cars and transportation and childcare. So all of this comes into play, and it's a lot of risk factors. And the supports, you know, supports are so important. If you think of, you know, when something goes wrong in your life, or if something is about to happen, if you think of like, oh my gosh, how will I handle this? You think of all of the supports that come in your life, right? So whether it's family, whether it's close friends, for individuals who have to get rid of all of their people, places, and things that they've known, finding healthy support sometimes can be really difficult. Sometimes it can be really great. I'm totally biased, but the groups that we work with, I think it's amazing, because that's one thing they build is this amazing support where they support one another and go above and beyond in providing support. And so I think that is so significant, and I think it's so healthy. But it makes me sad when I think of all of the families we work with and how unhealthy their family supports are for them, and other supports around them. So supports are a huge piece, and many of the times it can be a risk factor in recovery because there's no healthy supports, or sometimes they've had to get rid of some of their supports. Sometimes they've naturally lost some of their supports, right? And they're dealing with those consequences. And so that can be really difficult too. Like we talked about, legal problems and emotional distress. I mean, going through all of that, like just saying that sometimes puts like heaviness on my chest. I think of everything for them to go through. But it's so much. I can't even tell you how. I mean, I'm preaching to the choir when I'm talking to you all, but thinking about everything that our families go through, it's a huge risk for their family system. It's a huge risk for their children. Even just trying to get their children back many of the times once they've CPS has gotten involved and has taken custody. Many of the times, just getting their children back, there's such confusion about what they need to do, if they need to do supportive housing or focus on their recovery or to get a job, right? Like, so in doing all of that and reporting to day report for UDSs, like that's a couple full-time jobs in itself. And so finding time to do all of that is very emotionally draining. And finding rides when you don't have those supports, right? So we look at these risk factors and how much they play a part in their lives, how much it becomes like a cycle. But what does this mean for their kids? Is a lot of the times it can mean a disrupted attachment, right? Especially if we see them going to CPS early on and then change from household to household to household. I've had several families that have prepared, right? In pregnancy, they knew that their child was going to be removed and prepared for what that would look like. But sometimes it doesn't always come in fruition to what their plans fall through. And I had one mom. She did great at play. She was definitely a planner. She was planning, planned for her child to go live with her aunt. And her aunt didn't have any children. And once the baby was born, the baby did go live with the aunt, and the baby did struggle with some withdrawal when the baby was born, and the baby was highly irritable. And so stayed with mom in the hospital, stayed with mom for 5 days in the hospital, and then went with the aunt. The aunt could not care for the baby. So then the baby went with her sister-in-law, who had 4 other children, could not care for the baby because she had other children. So she said she could, and then she's like, oh, this is a little much. So then she gave the baby up for foster care, and mom did everything she could to get the baby back. So the baby was back within the 6 months. But by that time, baby's been through 4 placements, right? So that's a huge disruption with their attachment. And so just as they're starting to reach all of these levels of attachment, they're going all the way back to the beginning because they have to start over with somebody new. And by 6 months, when you're determining a preferred caregiver and who you like the most and who cares for you the most, you're really just starting to figure out that you can trust an individual. And so that puts them back social emotionally and sometimes developmentally. And so we see a lot of that happen. So that's an early life stressor for sure. That increases their risk for adverse childhood experiences. Many families that I've worked with, they have several adverse childhood experiences, right? Many are struggling with their own mental health, with substance use disorder, with poverty, right? And so they have several adverse childhood experiences that would impact. Inconsistent parenting, of course, like we said, different households, inconsistent parenting. Sometimes we have individuals who live in multi-generational households, which is inconsistent parenting too, because sometimes you don't always agree on how to care for children. Unpredictable routines help kids feel safe and secure. And so unpredictable routines can kind of throw them out, and having those multiple caregivers and not really knowing who's who and who they can trust can have such a huge impact. And this can also have a huge impact on caregivers, right? So it can disrupt their attachment and increase their parenting stress. So, it shows that it's an increase of toxic stress levels when parents are unable to care for their children because they feel this level of guilt, they feel this level of hopelessness, they feel this level of failing. And so we see all of that happen with some of that parenting stress. And a lot of the times parenting for babies who are unconsolable or who have had disrupted attachments is very difficult. So it's less rewarding, right? And we talked about how important that reward piece is to their brain system and to that circuitry, and to stimulate that overstimulated piece, right? They're rewiring that. And so meeting that need is huge. And there's a lot of literature that supports that without them feeling like a rewarding parent, that it can lead to a reoccurrence. And so it's really important to feel like they're meeting those needs. And sometimes with some irritable babies, depending on their temperament and what they've been exposed to, sometimes you just can't meet that need. So sometimes it has nothing to do with their parenting styles, which makes it hard, but it's still less rewarding, right? And it's hard not to internalize that guilt that you already feel. So many of our parents already have this guilt of using or being in the position that they're in, that it's really hard for them to let go of that and move forward because of their low self-esteem, right? And self-worth, economic pressures, feeling that despair and hopelessness we talked about. So when you talk about that, so there's a natural piece too, right? There's a natural piece to parenting that creates all of this stress. So like I said, having a substance use disorder is like making it 2 times the amount. So T. Barry Brazelton talks about, and just to kind of put that in perspective for you all, T. Barry Brazelton talks about this normal dysregulation, right? So it's this disorganization and dysregulation throughout a child's development. And anytime they go to meet their like milestones, right? So you see it at like 3 months. So naturally there's dysregulation and this disorganization when a baby's born, and their rates and rhythms are starting to come into play. And then it comes again about 3 months, and then 6 months, and then 9 months. And then you see it like at 10 months and 12 months. So there's a lot of developmental pieces where children automatically become disorganized, and what happens in the family system, and that you see. And if any of you have raised children, think about like when you get a kid to finally sleep through the night, you're like, oh my goodness, right? Like getting a good night's sleep is like, seems like it took forever. And then here comes the sleep dysregulation in about 3 months. So just when you get used to it, then comes this developmental stage where they start to get a little disorganized, and they get dysregulated in their sleep, and they don't have the same sleeping patterns. And that changes within a month. But before that changes, there's disorganization, right? Because you're finally sleeping, you're finally getting that. And for somebody who has struggled with their moods and regulating their emotions and regulating their sleep, now their child is struggling with sleep too. And so here comes all of those thoughts, right? Again, about, being a failure or not being able to regulate your child, when this is a natural stage of life. This is a natural dysregulation. And so parents and children dysregulate together, and then you have to regulate. But if you see that arrow that's pointing down, that's a derailment, right? And many of the times, if people get stuck in those thought processes, then you have this derailment where they just feel like a failure and continue to feel like a failure and unable to recover from that. And it becomes huge. It totally impacts the interaction, right? It impacts the pattern of that serve and return in that dyad. And so sometimes natural development has such a huge impact. But like I said, having a substance use disorder on top of that almost puts it like at risk 2 times of that derailment, because you're already dealing with your own mood issues, your own sleep issues, right? Your own instability of your emotional regulation. And so then throwing it into some normal, typical development and dysregulation can be a huge struggle. Disrupted attachment early on can affect a child's emotions and regulations. They're less social competent. You can see aggressive behaviors increase. Again, school readiness has such a huge impact. We see a lot of the behaviors start to kind of present in school, and then later psychopathology. And so it can have a huge impact if we don't get out of that derailment. And so it's really important to kind of get out of that derailment. And long-term impacts are huge, right? So like These are extreme cases, but this is, if this is like an abused brain, right? So a child who's been really neglected, so not really tended to, not really cared, none of the serve and return has gone on, right? That derailment has gone, and then not really been repaired. And so if you see on the left, it's a healthy brain, and then you see on the right, this is based off of an orphanage where a baby has not been tended to very much. Some no abuse, but it really has been severely neglected. And so you'll see how that frontal lobe is just, huge holes when there's already huge holes in the first 5 years, right? There's already some of these significant holes. And so you see even more that just isn't generating. And where you see, what I found interesting too, is down at the bottom where you see some of the highest activity, this red on the abused brain, is the emotional piece, right? And so that's where emotions hit first. And so that's the highest activity. And so we see a lot of the times in some of these severe cases of neglect and not being able to meet some of those needs, not really having that trusting caregiver, you see very emotional children. And so it has a huge impact on kids emotionally, right? Because that's the part of their brain that develops first. And so everything becomes emotional. So you have these parents that are like, they freak out over everything, or their emotions are so extreme, right? And it can be really difficult to deal with. And now think about having a family that struggles with a substance use disorder, bringing this child back in and hoping to love and care for and take care. And they have all of these big emotions, right? And so there's a lot of repair that needs to be going on, but it's a natural response. This is one of my favorite quotes. So as we move on to talk about how providers can help in these situations, this was an anonymous mother who was talking about her nurse. I needed someone to love me when I could not love myself, because this helped me love my baby more. And I accidentally pushed my bed. And this mom talked to me about, like, this was the quote I took from her, but this was a patient that really worked hard at this repair piece, right? Reflecting on her past and the repair piece. And when she talked about this, she talked about how the nurse would show her pretty much how to parent, right? And that can be really difficult, and that can be really hard for someone to accept. But the nurse did it in such a soft, gentle way that she built this relationship with this mother in advance. And then she started just giving her these tidbits, these little parenting tidbits, right? Almost kind of like a nurturing mother, she described her as. She's like, it was like she was my mother-in-law, but I don't have a mother-in-law, right? She's like, she just kind of like gave me these little pieces. She's like, and she loved me. She loved me by giving me these pieces. And so I think that's huge. I think sometimes it's really hard to find those open doors and to find those spaces to do that, but how very important it is and what a huge impact it can make. And I think sometimes we don't think about those things as providers. I know for me, especially, I get into my day-to-day routine. And I think about those little pieces, like all these little tidbits that we can just give to help provide those support to those relationships. And so I think about this model, when you're moving forward as a caregiver, the caring relational model, just caring and building that relationship and how important that is, right? You have to do that first. And you have to have cultural competency around the population you're serving. You have to understand the population, everything they're dealing with and what they're working with, so that you can effectively build that relationship. And really, once you have that relationship and understand the population you're working for and care for them, it's really easy to move them forward, right? I always say you can get pretty much anybody to do anything once you have that relationship with them. And I think about, all the families we work with and how much they trust us, right? Like I think of our groups, and we were getting ready to move groups not too long ago, and our group members were just like having a fit because they wanted to be together. But in the end, and they like protested to me, and they're like, I don't care what, we're going to determine who goes in these groups, and you're not going to tell us where we're going to, right? And they took this stance, and it was like this way to advocate for themselves, but in a respectful way. They were totally being respectful to me. And in the end, like they said, because they trust, they're like, well, we know you're going to do what's best anyways, and we trust whatever decision you're going to make. I mean, by that time we gave in to them and let them all be together because they work so well together. But but that just shows like that's a caring relationship, right? They respect me enough to kind of stand up for themselves and approach, but still be respectful, and then trust me in the end, even in whatever decision we make. And so I think that building that relationship really helps in the long run. So always doing that first. How else providers can help? Checking in with themselves, providing compassionate care, explore and build, and we'll talk a little bit more about these, and help parents remain emotionally in tuned, right? So remember, half of the population we're working with, more than half, 80% of the population we're working with is dealing with complex trauma. And so they don't have that emotional attunement. Things that become natural for us might not be natural for them. Some natural parenting pieces or cues that you might pick up on are not always natural. And then sometimes they feel like they have to be these parents that are perfect. And the reality is perfect and parent should never go in the same phrase, right? Like it's all about trial and error. And so helping them understand some of these normalcies as well, and anticipatory guidance on what that development looks like. So checking in with self as a provider, just making sure that you identify what feelings you're bringing to the situation and authentically engaging. Be yourself. Be aware of what your body language says, right? While you're trying to build this trusting relationship. Make sure you have positive interactions. Talk positively about people. I had a staff member that one time, she would come to me and she'd talk negatively about this family all the time, just negative, negative, negative. And so we talked about that, and she was having, some counter transference. And once we processed that, she started managing the family much better. But if you talk negatively there as a provider, there's a chance you're going to carry that over at some point in time, right? And now there's always a time and place. Don't get me wrong, I get frustrated. And we have those spaces where we voice our frustration. But if it becomes a habit that you're doing it over and over again, I'd really encourage some self-reflection and really shifting that, because you're going to take that energy in there. And if anything, individuals with substance use disorder have that hypervigilance of emotions and constantly feel like they're being judged. And so they can read that automatically. And so it's really important to be aware of that. Reassure confidentiality. We live in a very rural area, and many of the times our patients are worried that we're going to share things or say things to people that don't need to hear them. And so reassuring that this is their business, and keeping their business safe and confidential, and making sure that you're bringing compassion versus consequences, right? So be more compassionate than pulling in those consequences, and promote that reward system, right? So that circuitry that we're trying to promote, that reward system, it's super beneficial. Providing compassionate care. So in the dyads, absolutely working on some newborn care. Like I said, integrating some of those little tidbits of parenting pieces and reading cues and responding to cues. Talk about breastfeeding and bonding. Talk about normalize what's going on, mood changes, poor sleep, right? How those influence and impact not only the parent, but the child as well, and how that relationship and that dyad can be impacted by that. It's important. And sometimes it's very relieving for parents to hear that and to talk about that. I know in our group, we talk about poor sleep a lot, and sometimes the parents don't realize that, this impacts their mood significantly. It impacts their child's mood significantly, right? Working with kids, if you work with kids, that's one of the first things you ask is about their sleep, because how huge that has an impact on their mood. And for yourself, if you don't get enough sleep, I need my sleep. Like, that is very important for me. We don't realize too, but we shift the focus after a pregnant person has their baby. We shift a lot of our focus to the baby, right? And so for a pregnant person who is getting a whole lot of attention and needed some of that attention, and isn't really emotionally in tune, but was getting all of these emotions that is now not, sometimes that can be a little depressing and it can impact their moods as well. So making sure that we're aware of that and we're still providing some of that attention is important, but also understanding their loss of resources. Many times then the pregnant person too then has increased financial stressors and can lose their insurance. And so that's a huge stressor. That's a huge stressor when you got a lot going on. And then the cultural mom norms, right? The pressure of being a perfect parent again. There's that word, perfect parenting. We have all kind of social media that shows all of these things that we should and should not do, and TikTok that tells us what's wrong with us if we aren't doing it. And so you have so much out there that influences. And it can be a positive influence too, but sometimes it puts a lot of pressure for a mom to be culturally normal, right? To do certain things for their kids or have to do certain things for their kids. I had a mom that was telling me, I went to see her. I know I've told this in here before, but I went to see her not long after she had her baby, and her mother-in-law was actually there helping her as a support. And her mother-in-law went out to have a cigarette. So she was like, she's driving me crazy. And I was like, why? And she's like, she's able to read the baby's cues and I'm not. And I said, well, what do you mean? And this was something she worked on. So this was something that was important to her because we worked on it prior to her delivery. And she's like, well, the baby cries and she knows that she's hungry. And I couldn't tell that that was a hungry cry. And I said, well, what do you mean? And so as she started talking about it, I said, well, your mother-in-law also has had 5 kids, right? So she naturally knows it's been 2 hours and the baby's starting to cry, that the baby's hungry, right? And so this is just kind of an answer. I said, you don't really read babies' cries until like 6 to 9 weeks. And she's like, what? Really? And like, it was like a breath of like, oh, okay, so like I don't have to know that right now. It's like, no, you don't. You shouldn't know that right now. And she's like, okay, that makes so much sense, right? Like, but just this anticipation of having to know that and to know what cry it is and to be able to meet that need and all that pressure she put on herself really was huge. And so just looking at some of those cultural mom norms and maybe even exploring that, right? A lot of the times I'll explore with families like their cultural beliefs of upbringing and what that looks like and what raising a child looks like and what they think raising a child in this world will look like, right? So not only within their family system, but within society and what that looks like, because there's so much pressure that's placed on them within their family system and within society. And so really exploring that. Exploring and rebuilding. So this is my favorite part, right? Like this is what I do. This is when I get excited because you get to explore, right? Like you explore. So during the pregnancy, you can explore their sensitivity, right? What they are thinking it's going to look like, what parenting, what ideals they have of parenting, what they've been through, what they've experienced, and then trying to help them meet some of those goals. Parenting behaviors. So what they really do, what they do when that child is bored, how they respond, how they act, right? And so really working with some of that and sometimes building that, teaching parents how to parent from a distance. Many of the times I'm working with parents who have children within CPS and foster homes, and there's not very much they can do. Sometimes it's very limited what they can do if it's supervised and then unsupervised. And so different levels of what they can do. And many of the times the parents I work with focus on these areas, kind of get obsessed or hyper focused on these areas that they really can't control, right? And so sometimes I had a mom that focused on the baby had a rash every time that she would see them, so the first thing she'd do is strip the baby down to see if the baby had a rash and then obsess on that the entire visit, right? So then there was really no connection that went on because she was so frustrated that the baby had a rash again, and she told this foster mom not to use this certain diaper, right? Like so it's this obsession that goes on and on and on. Instead, teaching her how to let go of that and really focus on the relationship and what's going on at that time. And to be present and how to be present and what that looks like, and what they can do during that interaction to manage some of those thoughts. And so really learning to parent from a distance and how important that is. And then helping her find ways that she can manage some of that, right? Because that's beyond her control, but it's still very frustrating. And so finding ways that we can help advocate with that. So teaching parenting from a distance can be huge. Mend and repair. a lot of, like we talked about, those derailment pieces, many of those relationships have been derailed. And so we're talking about how to mend and repair those relationships. How do you mend it and what do you do to repair? And a lot of it is about consistency and being there and that predictability. And then those interactions and working on those interactions, which include emotional availability, which can be very difficult, right? And that all builds that trusting relationship. And so building a reflective capacity too. This goes back to that caring relationship, and cultural competency. When you're building a reflective capacity is about building a relationship to where that person, that caregiver, feels safe to explore how they've been cared for, or the traumas that they may be bringing, so that they can heal some of that and be emotionally available for their child. And so building that reflective capacity is a little bit deeper, but it's really about building that relationship so that they feel comfortable with doing that. Okay, I'm gonna play. No, maybe not. Maybe I won't play that video. Oh, yes, I will. I lied. Maybe I hit it the wrong place. Let's try this one. Yes.
Parents. Throughout history, we've struggled to get it right. We hope we won't pass on our emotional issues to our kids, and we swear we won't make the same mistakes our parents did. We all have great intentions, but something seems to get in the way. Let's look at what that might be. At Circle of Security Parenting, we believe that being emotionally available to our children and their needs is the key to doing our best as parents. We call emotional availability being with. It means teaching emotional intelligence by being with our children in all their feelings, like sadness, joy, anger, curiosity, pain, frustration, excitement, and so on. Being with children helps them understand, trust, and move on from feelings. And knowing someone is with them in their feelings helps children feel less overwhelmed and more secure. Decades of research backs this up. For parents, some of this comes easily, but other times our children express emotions that make us uncomfortable, so we pull away or try to overrule their feelings, which leaves them on their own. We do this because our children's feelings can trigger strong emotions in us. We think of it like this: our history during childhood of how core people responded to our different emotions creates the background music for how we experience our children's feelings. Let's look at this example. This girl and her father have been enjoying time together in the park, but suddenly aware of the time, Dad says, "We need to go." When the girl hears this, she starts crying and gets increasingly angry. All at once, the dad's background music changes. The background music that is playing for the father right now, we call shark music. As it turns out, the dad's own mother was uncomfortable with loud displays of emotion, and she didn't know how to handle them. So throughout his childhood, she repeatedly told her son it was pathetic to cry, and she never ever asked him about his feelings of sadness or anger. His ability to deal with his daughter's emotion now is greatly affected by the experience with his mother then. Shark music. We're rarely aware it's playing, but it's our past experiences telling us to be afraid of or uncomfortable with a feeling or need that is actually safe. When our shark music limits our ability to respond to these feelings, our children learn to hide or feel ashamed of them. This is a problem because we're teaching our children to fear emotions that are actually both safe and essential in life. Most of us experience shark music with one emotion or another, and it's different for everyone. But whenever it is triggered, our ability to respond to our children's needs is limited. The good news is, by simply calling it by name and reflecting on what our children need in the moment, we can turn down our shark music. This is so important because if we can learn to manage our history of negative experiences and perceptions, we can respond to the truth of our child's current situation and be with them in it. Ultimately, This will help our children grow up with a better ability to understand and share more of the emotions they experience. There's no escaping it. Strong feelings are a challenge to manage as parents, but our children always benefit when we have an accurate response to what's happening, rather than reacting to the sharp music we're bringing into the relationship. Remember, there's no such thing as perfect parenting, and blame never helped anyone feel more secure. That includes blaming ourselves. But the more often we can identify our sharp music, the better off our children will be.
So that's a reflective method called the circle of security. It's designed to be in a group setting, and it's really great. But these little pieces are all through reflective practice, right? And so building that capacity just to be emotionally available, and what they refer to as being with. And so building that reflective capacity, like I talked about, is all about building that emotional availability. And if you think about anybody as a parent, it's super stressful as a parent. Like I said, somebody struggling with substance use disorder gets it like ×2, because it's already a super stressful job. Having multiple kids, super stressful. Dealing with life stressors, super stressful. And then put in a substance use disorder, like you're struggling with managing your emotions, right? And leveling those out and dealing with your mood. And so it can be super stressful. And that's why having those supports and having providers that understand and are culturally competent is really important in understanding that and moving forward. So we want to build resiliency, right? We want to build health, overcoming this disease, dealing with their recovery, being supportive, and making sure they're getting those needs met, and that their emotional well-being is supported. Having a home, somewhere stable for them to live, right? And consistent. Like we talked about, many of the times this is one of their goals anyways. And so trying to find that stability is huge. And I know when we're working with families, if they don't have a healthy, stable environment, it's one of our high risks, right? That's a red flag for us. Like, we're keeping an eye on them. We're seeing sometimes when they have unhealthy people coming in and out of their lives or their homes, we talk about that every time, because it's really important. We know what a huge influence that can be. Finding purpose, right? Having a purpose, even if it's being that parent, having that purpose and being successful at that, but also having a purpose and feeling good about their jobs. I can't tell you how many parents I've worked with that once they've got a job and they have a healthy supports at their job, like they just flourish, right? Like they do really great. We have one parent that is like super successful right now, and really all of her support is her coworkers, and she didn't even get her children back, and she's been super great throughout her recovery, right? And her coworkers are really who brought her through all of this. So it's amazing how much that sense of purpose can be, and that community can be to an individual. So having those relationships, having that network, having friendships, having love, having hope, and moving forward is important. Other protective factors, making sure we're meeting some of those concrete resources, right? Housing, cars, there's so many programs out there, right? That can help individuals who struggle with a substance use disorder, strengthening that support system, helping them identify who that support system is, their own emotional and psychological recovery, parenting education and tips, understanding that social emotional development and cognitive capacities. So understanding a child's development, their social emotional development is really important, because many of the times they go to a pediatrician and they get their regular developmental milestones and then talk a little bit about social emotional development, but it's such a relief once parents get some of that education. And honestly, like the further along the parents I work with get in recovery, the more they want to know about this, and the more that they want to know about how they influenced and impact that development and how they can help them build. And so, sometimes sharing how they've impacted has a huge impact on them, and it kind of recirculates some of those feelings of guilt, but then bringing in how they can continue to move forward is really important. And I always talk about that. I talk about children's brains and how resilient they are, and how we have neuroplasticity, so like you can change it all the time. And so they like to look forward to that, to the future, but just remembering that they impact one another, right? And so we know that babies need all of that love, but so do parents, right? Parents need to feel it just as much. And so it lights up just as much and builds some of those neural pathways that are really important when it comes to a substance use disorder. Any questions? Oh, those references are super little. I don't know what happened to those. You'll get the slide so you can look at those references. Any questions? No, none.
Feel free to use the chat if you can't unmute. Throw them in the chat.
Can I present an impromptu case?
Yes.
Okay. So I just wanted to throw this out there because I think it touches on a large developmental swath in terms of the impact of substance use on the child. So I'm working with an individual who used stimulants during her pregnancy, and the baby was removed and lives with her mother. And she has a not great relationship with her mother. We're coming up to about a year since the removal. She's having visits and she's progressed. She's remained sober since she had him. So she's coming up on actually a year of sobriety. And she will probably get him back, which is great. And I'm thinking of like how best to equip her with all of the feelings she may have when he returns in the context of her relationship with her mother, who she believes doesn't want to give him back. I don't know if that's true or not. I've never met the mother. And, you know, her guilt and shame and wanting to be the best parent she can be in the developmental stage where the kid is going to be, which is about a year old. And she's, you know, the child is probably the primary attachment figure is her mother and not her, and the feelings that brings up. So some thoughts on that.
Yeah, I think that's a really common scenario, right, that we're seeing. And if you saw some of the trauma pieces that I talked about, I highlighted caregiver betrayal, right? And a lot of the times we'll see that they feel betrayed by their caregiver because the caregivers do naturally become the primary caregiver, and the preferred caregiver from the child. And when we talk about attachment and kinship care too, it's the same thing, right? So really working with them in a reflective way to kind of resolve some of those underlying emotions that are being triggered for their child, really preferring their parent, and resolving some of those emotions so that they can come alongside. So it's like a parallel process, right? We want them to come alongside and build this relationship along with the grandparent, right? So that the child sees that relationship growing, trusts that adult. And so once they trust that adult, and then they can kind of open up and they continue to build that relationship with that child. So that consistency, that communication, that stimulation, building that relationship with them and continuing to work on it regardless if they're their preferred caregiver or not. But a lot of the times in my experience, they've had to receive treatment alongside while they're building that, because being rejected time after time is not a great feeling. And already having that, I've not worked, I mean, I've done this for, you know, Lori, you've introduced me to this. I've done this for 8 years now, and I've not worked with a parent, maybe one, that has resolved that guilt from using during pregnancy or around their pregnancy, or having guilt around losing their child. I've not dealt with many parents that overcome that guilt. It's still triggered even years after. So it takes a lot of work to build on that. And it's huge. And you have to be gentle with it, but it's important for them to stay there and to be consistent and to be a consistent part, because that early on attachment is what's going to help them build that attachment with that parent. But it's hard. But once the parent accepts that that's the preferred caregiver, it goes much better. Those unresolved issues continue to come up, and that's where treatment is important. But it goes along better once they're able to accept that. So I think the first step is getting them to accept that. But yeah, absolutely. That's a really good point.
Hey, can I add a comment to that? This is Dr. Wanda
Yeah.
Genis from Unicare. I'm a pediatrician, and so I often have the opportunity to not only work with the child, but also with the parents. And so in this situation, you've got the grandma who's been taking care of this baby for a year, and now all of a sudden, mom um, is part of the picture. So I guess my question would be, first of all, has mom been involved in any of the child's care, or at least attending the visits with the grandmother, so that the child knows that there is another person who cares about him or her? And even though they're not the primary caregiver, they're familiar with that particular person, i.e. the biological mom. From a developmental point of view, we have a 1-year-old, and while yes, there are some um, direct attachments, emotional attachments that have been made primarily to the grandmother, that will also change depending on how the grandmother involves the mom going forward. So if the child constantly hears negative talk about mom, even though mom is around, um, or when mom is not around, or that will have an impact on the child, which is totally out of the mom's control. So I think I definitely agree with the counseling and the therapy part, but I think there's some family therapy maybe that may need to go into play here, because grandma needs to understand how she can now integrate mom back into the picture before mom gets full custody, if she's allowed to get full custody back through the courts.
Yeah.
From the child's point of view, again, having that stable, consistent presence will be helpful for that child. Um, but um, but certainly children will feel abandonment even at a year of age. And so again, that transition from to a new household may be challenging. And the kid who used to be sleeping through the night now may not sleep through the night.
Yeah.
Or the child who used to eat really well becomes a super picky eater, or now has temper tantrums that seem to be out of control. And all of those can be very much related to the emotional dysregulation that has happened, not just from moving from a known environment to a new unknown, but then also all the back chatter that might be going on as well.
Yeah, I think that's Larry, I think that's a really great point, is that back chatter is really, it's actually very damaging in all situations. And so that's why I say it has to be a parallel process. And absolutely all of the research supports that it's most beneficial for family therapy to be involved, because you're dealing with a lot of different emotions and layers of emotions, especially when you're dealing with like generational pieces. And even when I went to a conference that on building attachment through kinship care, and like some of these foster families that would participate, even that family system, right, as they move to reunifying them with the biological parent, like those are still family systems, right? And so doing therapy, even those situations, can be beneficial. And so you're absolutely right. Children can feel things very early on, even from being born, right? They're used to their mother's rates and rhythms, and they can hear two voices outside of their mothers in their third trimester. So going completely to somebody else has an impact on them, has an impact on their distress levels and their eating, sleeping. So you're absolutely right. At 1 year old, they can feel that rejection. And so it's really important to kind of minimize that. And children are sponges. They will hear and they will predict what their environment should look like based off of their trusted caregiver. And if their trusted caregiver is talking smack on their mom, then they're not going to like their mom anymore, right? Like it's just going to happen. So you're absolutely right that that's a cycle. And like I said, it has to be a parallel process where they come side by side and work together. It's a lot of work. It's a lot of work. Great comment, Phil. Great points.
Got about a minute to go. Any other comments or questions? All right. Well,
Well, Jay,
Oh,
one thing,
go ahead.
the only
Yeah,
thing I would
sure.
add, Jay, is that it's not just the infants, because I have seen and experienced teenagers who were in the foster system as infants, were born exposed to drugs in utero, and were placed in a stable adoptive family, and yet experienced significant dysregulation particularly as they entered into puberty. So that's also could be a huge stressor, not only for the child, but also for the adoptive family. And if the biological family is anywhere near involved, for them as well.
Yeah, I think that's a really good point, because it is, I mean, attachment is lifelong. And even if you have that initial attachment, and when I talk with foster families and adoptive families, and children always have this need to want to meet their biological parent and just wonder and have that sense of rejection, like you're talking about, Hillary. Like that sense of rejection, it can be a huge barrier. And so absolutely throughout their lives.
Okay, we are at the hour. Thank you for all the comments, the impromptu case, Laura, and then of course Amanda for the wonderful didactic. We'll be meeting again in October, on October 9th, so be on the lookout for more information on that. And until then, we will see you in a month.
Bye, everyone. Thank you.
See ya.
Thanks, Amanda.